Hi, and welcome to the overview for the AZ Health Zone Childhood School and Youth Serving Systems Focus Area. AZ Health Zone is Arizona's SNAP-Ed program and is funded by the USDA to improve health outcomes through nutrition and physical activity supports. In this presentation, I will define the school system strategy related to activities carried out by AZ Health Zone local implementing agencies and communities statewide. The purpose of this overview is to summarize the school system strategy and related activities carried out by AZ Health Zone implementing agencies. We'll also briefly discuss the role of the state implementation team's school system specialist, and finally, how resources on the AZ Health Zone website work. Let's explore the school system strategy within AZ Health Zone. No overview of this area would be complete without the whole school, whole child, whole community framework, known as the WSCC model for short, which encompasses all aspects of child wellness in schools. You will see that our funded activities are part of the whole and are interconnected to create and support student health. This model was developed by the Centers for Disease Control and Prevention and the Association for Curriculum Support and Development to bridge the public health and education sectors, and it really should resonate with school administrators that you will interact with. I like to call this the big hug, with the student in the middle, surrounded by all the tenets of health and ultimately by the community. It is important that all who work in school health and wellness understand this model, but of course, your specific work will primarily be in the nutrition and physical activity areas of the framework. As AZ Health Zone local implementing agencies working under our SNAP-Ed funding, our focus is on promoting nutrition and physical activity among youth in our sites. While our focus is narrow, interventions around these topics can, as we know, help to support both physical and emotional health through eating nutritious foods and getting plenty of stress-relieving activity, which is so important to us all during this time. We do our work in a policy system and environmental change model because we know that supporting individuals through changes to the systems people live and work in can improve the chance of individual changes being sustained. So, a little bit more about the PSC model. These types of change work beyond the individual level, and you will hear about PSC changes often in AZ Health Zone work. The SNAP-Ed federal guidance offers the following descriptions. Policies are written statements of an organizational position, decision, or course of action. Systems are changes that are unwritten, ongoing, organizational decisions, or changes that result in new activities reaching large proportions of people the organization serves. Systems changes alter how the organization or network conducts business. Environments include the built or physical environments, which are visual and observable, as well as economic, social, normative, and message environments. We strive to accomplish positive health outcomes in the school and youth serving strategies through using evidence-based interventions you will recognize as activities we conduct within our schools and our sites. The school system's activities include local wellness policy, policy revision and communication, staff development, school and youth-based agriculture, nutrition environments and practices, physical activity environments and practices, community coordination, and community engagement. We start with local wellness policy revision and communication because under the PSC model, we know that supporting existing policies can impact individual changes in students. These local wellness policies are a mandate as a result of the Healthy and Hunger-Free Kids Act of 2010. All schools that receive funds through the National School Lunch Program are required to have a policy that governs nutrition standards and physical activity on their campus and to examine and revise it every 3 years. The other requirements under this policy are to gather community input and to make it public. This provides a great opportunity for us to be of assistance to both our schools and our departments of education partners who monitor these policies. A strong local wellness policy can support all the changes necessary for wellness on a school campus. Because one of the requirements of the local wellness policy is public participation, schools need to demonstrate how they are gathering participation from the community. What is considered a best practice for this is to convene a wellness team in each district or campus. The wellness teams should be made up of people from all of the wedges of the WISC framework to ensure that all facets of staff, student, and campus health are considered. It is suggested that these teams meet 4 times a year to engage in the cycle of assessment and improvement, and that it is a representative committee. Also remember that a new committee does not have to be established if there is an existing committee that can attend to the local wellness policy and school wellness matters. Along with wellness teams, increasing the capacity for the teachers and staff to understand and deliver wellness topics to their students is an important way to support wellness in schools and youth-based settings. Experience has shown that teachers who embrace personal wellness are more likely to influence their students to adopt healthier habits. Classroom teachers and cafeteria staff are integral to implementing what is in the local wellness policies, and you can help inspire them to act on it through trainings on the importance of the wellness policies and how to implement easy changes in their classrooms, such as brain break energizers throughout the day or encouraging non-food rewards with their students. Another activity in our school wellness strategy is school and youth-based agriculture. Gardens are a popular intervention for many reasons, and many schools like the idea of utilizing them on their campus to promote healthy eating among students and providing outdoor education opportunities. AZ Health Zone local implementing agencies can train school and youth system partners to implement and sustain gardens and to support local food procurement for our cafeterias. An important part of our work in schools is supporting nutrition environments and practices. Some of the ways we do this is through assisting in implementing campus nutrition standards, nutrition education, and direct education to students. A primary environmental support that we can offer to our sites is the Smarter Lunchrooms movement. The SLM assists cafeteria settings to support students to choose the more healthful menu choices through using behavioral economic strategies. There is corresponding virtual SLM training related to both program implementation and evaluation that you can find on both the state implementation team and state evaluation team websites. Please contact the SIT or SET for more information. Our work to support PA environments and practices is easily conceptualized through the Comprehensive School Physical Activity Program, or CSPAP for short. CSPAP supports improvements in PA practices and environments throughout the school day that can add up to the 60 minutes per day for children as recommended by the American Academy of Pediatrics. For instance, active transportation to school, adequate physical education opportunities, classroom brain breaks, and time for recess can all easily combine to add up to that important 60 minutes. A big part of our work in the last few years has been to support the 2018 Arizona law that requires all K through 5 publicly funded schools to provide 2 recess periods per day. You will find a nice toolkit for use with your schools in the collaborators page under the childhood section. AZ Health Zone also has stencils that are available for checkout that can make an attractive and active recess space in your schools, and you can also find these on the collaborators page. When working in school settings, we know from the WISC model and from experience that many other entities may be working with our schools, so it is important to know who all the partners are and how to access them for coordination of our efforts. Once we know what is already occurring in our schools and what the needs are through assessment, we can then begin to help fill those gaps. It might be food insecurity, a lack of safe drinking water, or mental health services that you could pull together partners to assist schools with the improvements they desire. The needs that are identified by our schools may not always fit under our AZ Health Zone funding, but you can be of great assistance by knowing who the community partners are and assisting the schools to access them. Last but not least, community engagement is the eighth activity in childhood systems. Community engagement is one of AZ Health Zone's foundational principles, and you will see it as an activity under each strategy. The state implementation team defines community engagement as engaging residents in SNAP-Ed eligible communities in the process and planning using consulting, involving, and collaborating techniques. Work in the community engagement activity could look like one-on-one conversations with families, tabling, surveys, or accessing a PTA or PTO to understand how to best match SNAP-Ed programs and initiatives with the priorities of the community. Now that we've covered the school system strategies and activities, let's talk about the role of the focus area specialists on the state team. The AZ Health Zone State Implementation Team, or SIT for short, has multiple specialists working on SNAP-Ed goals in our state. These include 4 PSE specialists for active living, early childhood, school systems, and food systems, along with a direct education specialist and a tribal community specialist. The role of the school system specialist includes technical assistance, professional development, and statewide efforts. The specialist provides school systems knowledge on best practices, research, resources, and connections to other experts. The specialist facilitates professional development such as trainings, workshops, conversations, and other learning opportunities to fill identified gaps, wants, and needs based on local agency feedback and reporting. The specialist also serves on state-level committees, leads working groups, and coordinates statewide projects as capacity allows. Now, let's take a few moments to review the AZ Health Zone website and its resources. The AZ Health Zone website includes many tools and resources to help in your work. From azhealthzone.org, scroll to the bottom right and click Collaborators. Then click Childhood. You'll see an option to choose either the school and youth serving or early child care education strategies. After selecting school and youth serving, you'll scroll to see descriptions of each activity. Below that, you'll see the Tools section. View all tools, then you'll be able to use the search function. Tools are tagged by activity. So, for example, you could type in nutrition environments and practices to find all the tools related to that activity. These are just a few resources you can take advantage of. The USDA, CDC, Alliance for a Healthier Generation, and Action for Healthy Kids are all great national resources. For Arizona-specific resources, you will want to keep an eye on the AZ Department of Education website and specifically Health and Nutrition Services, which is where you can sign up for newsletters with all kinds of information about the school meal programs and school wellness topics. Additionally, you can sign up for newsletters from the Arizona Farm to School Network. Thank you for your time and interest in watching this brief overview of the AZ Health Zone School and Youth Serving System Strategy. If you have any questions or would like to connect about school health work, please reach out to the AZ Health Zone School System Specialist.